Hello everyone, myself Dr. Taposh Kumar Pal and welcome to our channel Physiomax Organization, and today we will teach you how to read a lumbar X-ray. Before showing you the lumbar X-ray and the process of reading it, we just want to inform we have taken the consent from the patient. That's the reason we are exploring the name and the age of the patient. So today's important topic is about the way to read the lumbar X-ray. So before starting off it, we just want to say those who are new for this channel, don't forget to subscribe the channel, and those who are seeing this video, don't forget to like the video. Now in this lumbar X-ray, whenever you used to see a lumbar X-ray, the two common views is the most important views we need to see. There's the AP and the lateral, and the time you will see the X-ray, the few things is quite important for you to know. First the thing you need to match, you need to see the names, and you need to match with the patients, and the age of course you need to see and match with your data before seeing the X-ray. And of course you need to see the date of the X-ray, and it needed to be recorded. In this X-ray we can see there are two views, one is the AP and this one is the lateral. So this one is the AP view and this one is the lateral view, and this is the most two common views which is needed for a patient to see. And for most of the times we used to give a patient to do these two views, so that most of the prominence we can see under these two views only. Now what exactly we need to see under the two views? So before going to the any of the pathological observation from this particular X-ray, we need to understand the anatomical landmarks. So first we will understand the anatomical landmarks of this particular X-ray. So we will start with the lateral view, which all are the anatomical landmarks is present over here. You can see this shadow, and this is what is the sacrum. This is the sacrum bone. Coming to this is the L5 vertebra, this is the L4 vertebra, this is the L3 vertebra, this is the L2, this is the L1, and this is the T12, and this is the region of the lower thoracic region. These all are the lumbar region, this is the lower thoracic region, and this is the sacrum. And also we can see the shadow of the spinous process. We can see the spinous process shadow of the lumbar vertebra, which is quite blunt and large compared to the thoracic one. See, we can see over here, this is the spinous process of the lumbar vertebrae. This is the angle, this is the angle of the lumbosacral angle, and this also is quite important. Some of the times we used to see this angle. So this is the lumbosacral angle. So these views which is seen in the lumbar region as a lateral view. If we go to the posterior view, we can see this is the AP view, and if you see the areas which it can be identified, we can see this is the sacrum over here, and this is the pelvis, and this is the sacrum, and quite easily we can see this sacroiliac joint line. This is the sacroiliac joint line bilateral on both the sides. We can see this sacroiliac joint line, and it's quite important for us to see these lines. Again we can see the vertebrae one by one. This is the L5 vertebra, L4, L3, and we can go up and we can see the ribs too over here. This is the lower ribs, and this is the thoracolumbar junction. This is the thoracolumbar radius, and this is the lumbar vertebrae. We can see the transverse process of the lumbar vertebrae on both the sides, and we can see the projection of the spinous process over here. This is the projection of the spinous process over here. So these all are the normal anatomical landmarks we need to understand before we see any of the X-ray. Now I will tell you what are the pathological findings or the pathological changes we need to see with the time we used to see the X-ray, or what all the orthopedic changes we can see in this particular X-ray. So the first things, whenever you will see a X-ray of a patient, you need to see the space, you need to see the lumbar of the space between each of the lumbar vertebrae, like this is the space of the L5 and the S1 vertebra, this is the space of the L4 and the L5 vertebra, this is the space of the L3 and the L4 vertebrae. So the first things you need to see the spaces, because in case of degeneration, in case of disc herniation, this space is to be reduced. So this is the first thing you need to see, the space of each of the vertebral bodies. The second thing what you need to see, the curvature of the spine. Normally we are having a lordotic curvature of the spine, but because of some postural deformities, because of some pathology, this curvature is to get diminished, or sometimes the curvature also can get increased too. So we need to see this curvature. We can see over here the concavity on this side, on the posterior side, that's supposed to be the concavity, and the anterior aspect that's supposed to be the convexity. That's the things we need to see from as a curvature. And that's the another second important point, the time we is to see the lateral view of the X-ray. The third important point, what you need to find out from the lateral view, these edges of the vertebral bodies, because this is the most common region to have the osteophytes. As we can see in this X-ray, there is a there's the initial stage of the acute degeneration over here, and this where there is a chance of having a osteophytes formation in these edges. Sometimes in the late stage of the chronic degeneration, we can see the osteophytes at the edge of each of the vertebrae. And also you need to see the sclerotic changes. Whenever there is a degeneration, we can see a whitish line on the edges of the vertebral body. That's what's the sclerotic changes, and there's the thing also you need to see from the lateral view. The fifth most important point what you need to see, that is the lumbosacral angulation. This lumbosacral angulation, again it is quite important to understand, is there any type of excessive sacral movement or excessive sacral tilt or not. So these all the features what normally we used to see from the lateral view of the lumbar X-ray. If you see the posterior view, now coming to the posterior view, if you see the posterior view, the most important point we are supposed to see the lines, gaps between these two. This is the pelvis, this is the sacrum, and most of the times whenever there is a pathology, this line gap it's not visible. This is the sacroiliac joint lines. We can see over here in the lower aspect the line is quite prominent, in the upper aspect the line is about to diminish, and we can see a fusion of these two. This is what's the important thing whenever you used to see the AP view. This is the sacroiliac joint line, and that's the thing we need to see from the AP view. That's the first point. The time we used to see the AP view, the second most important point what we need to see, that is this is the L5 vertebra. We can see the shadow of the transverse process of the L5 vertebra and the distance between the L5 vertebra to the iliac crest and the S1. Why this is important? This is important because in case of chronic degeneration, the L5 transverse process, this L5 transverse process used to get fused with the sacrum and the iliac crest. That result in severe pain and decreased range of motion, and that also we need to see on both the sides. Sometimes this fusion is to become unilateral or it can be bilateral. There's another second most important point what we need to see from the AP view. That's the L5 transverse process shadow, does it is in touch with the iliac crest and the sacrum or not. There is a condition what we can say as a sacralization, where we can see the fusion of the L5 transverse process with the iliac crest and the sacrum. The next point what we need to see in the AP view about the curvature of the spine. Sometimes this curvature is a lateral curvature we need to see from this AP view. Sometimes this curvature used to get tilted either on the right or on the left, and this is the lateral curvature, and we used to tell this condition as a scoliosis. And if we see properly in this X-ray, there is a mild change, mild right side tilt. That's the initial stage of the scoliosis, and that's also we need to see from the AP view about the curvature, either it is right side or the left side tilted or not. The last most common And the last most important point, being a pain care specialist, being a orthopedician or being a physio, you need to see that these markings we can see if I zoom it and if I show you, we can see over here these rounded shapes on of each of the vertebrae. See this there is a rounded shape on each of the vertebrae, these shadows. So what is the shadows is? These shadows denotes the superior and the inferior articular process. If you see this shadow properly, on the superior line you can see the whitish line and in between there is a blackish spot. That's supposed to be the normal. This is the superior and the inferior articular process where they makes the facet joint. So this is the markings of the facet joints. So what is the pathology? The time is to see the pathology. This blackish spot is to be whitish, that denotes the articular disc of each of the facet joint is degenerated, and that's another important point we need to see from the X-ray, and we need to see from the AP views of the X-ray, that is facet joint arthritis or not. So this is one more critical and the most important point we need to see from the AP view about this markation on all the sides. This markation is formed by the articular process of each of the vertebrae, mostly the superior and the inferior articular process of each of the vertebrae, which makes the facet joints. That means the inferior articular process of the upper vertebra and the superior articular process of the lower vertebra, which makes the facet joint. And whenever there is a normal shadow like this is the normal, but if it is facet joint arthritis, you can see the white in this spot instead of the black. So this is the another point, everyone. That's what you need to notice from these views. So this is about the today's learning, how to understand the a lumbar X-ray. So I hope you people understand the way you need to see a lumbar X-ray. So that's it for today, and another time and with another video will come up with new radiological findings. Till that time, be with us. So don't forget to subscribe the channel and don't forget to like the video, so that will be encouraged to make lot of educational videos related to the medical conditions for you people. Thanks everyone.